I was with a friend, Alexander Akebe.
Okay.
Then the idea came, I said, this one, some of the things that people even abuse, they don't know is an abuse.
Okay.
They think it's a normal thing that they do. So why not going up to this youth and then talking to them about an abuse?
Let me welcome you once again, and still inside the Upper East region over here in Ghana, in Navrongo. Yes, we've stayed here for some times and we're still touring the place to actually discover and showcase to you the beautiful places, and then also to engage with entrepreneurs who are changing lives positively over here, and then with the talented people. In fact, when we started, I've actually spoken with a lot of people over here who are doing exceptionally well for this part of the country. And fortunately for us, in fact, we've also come across this young guy who has also been changing the lives of the people, especially the youth, in a very positive way. And in fact, we cannot come here and return without speaking with this man that I'm talking about. The name that I know is Jesse. Yes, and I'm sure he's going to get us the actual full name. Now, you know what? This man has been able to come out with an NGO that is actually into giving out education to the youth who are abusing substances in our communities, in our societies, you know. There are a lot of places that when you, check youth, senior high students, the people around, you see that a lot of them are abusing drugs and all that, okay? This actual man I'm talking about over here, this young man has been able to come out with this NGO, and he has done a lot. In fact, he has done a lot. Currently, we're going to have a talk with him over here. My big brother,
Yes, sir.
how are you doing?
Fine, and you?
By grace, I'm also doing well.
Thank God.
So your full name, what I know is Jesse.
Yeah, I'm Jesse Kolu.
Jesse Kolo.
Jesse Kolu.
Kolo. Oh, okay. What's the meaning of that?
Kolu is a village in Navrongo here.
Oh, okay.
I think that was where they gave it to my.
Oh, okay. Wow.
They named me after the.
Oh, after the town. Oh, okay. Wow, that's great.
Jesse Kolu.
Oh, okay.
Yes,
great. So you are an inhabitant of the town, right?
Yes, please.
Oh, okay.
I'm from China, but I stay in Navrongo.
You're from
China.
China.
Yeah, like China Park constituency.
Okay. If you don't say it well again, people will think you are talking about China.
Oh yeah.
China.
Yeah,
okay. Is it very far from this place?
No place, no place.
Oh, okay.
Just some distance away from here.
Yes. Yeah. And what language do you speak?
Kasam.
Kasim.
Yes.
Oh, okay.
Kasim.
So, if you want to greet someone in the afternoon, how do you say that?
In fact, we have a general greeting where you can say Kuete.
Kuete.
That means how are you? So anytime you can say Kuete.
Kuete. Even in the morning, the evening, in the afternoon, anytime at all.
That time you can say Kuete. They will say Kugara.
They will say
Kugara.
Kugara.
How are you? It's
okay.
fine. So anytime you meet somebody, you can say Kuete.
Okay, so my people Kuete. So you respond there. Anyway, yes. So we've actually heard the good works that you're doing over here for the people of the north. Tell us more about it. What's the name of the organization? How did it start?
I think the organization is Careline Health Solutions.
Okay.
Careline Health Solutions.
Careline Health Solution.
Health Solutions.
Okay.
Yeah, we are giving some solutions to some of our basic
yes.
health issues.
Okay.
So I think that's the meaning of the whole name.
Very good.
Careline Health Solutions.
Okay.
As I said, I'm Jesse Kulu, a physician assistant with Ghana Health Service.
Wow.
I work in Navrongo, Uru Self District.
Okay.
Uru Health Center. That's where I work. But I have some private clinic to that I work with at St. Jude.
Oh, okay.
That is in Navrongo.
Great.
So I think the whole idea came, that was 2020. Where when I work in the hospital, I see that most of the conditions we get, especially road traffic accidents and other related conditions, most of the people are always, we have accidents that we know that, oh, whatever happened, an accident is an accident. But majority of the accidents were like related to abuse of substances and sort of things.
Okay.
So one day I was with a friend, Alexander Akebe.
Okay.
Then the idea came, I said, this one, some of the things that people even abuse, they don't know is an abuse.
Okay.
They think it's a normal thing that they do. So why not going up to this youth and then talking to them about an abuse? In fact, it's the whole population, but we target the youth because when you go into Ghana Narcotics Board, they said that 90% of all addicts, addicts of whatever substance, when you are addicted to any substance at your aged period, you started abusing that substance in your youthful age.
Yes.
So once you are able to stop the youth from doing this, then you have a healthy population.
Yes.
You understand?
Okay.
So I think that was why we targeted the youth. And when I said he is a teacher, so I said no, then why not collaborating with the teachers? Because they engage with a lot of youth. If I get the opportunity to collaborate with the teachers, then we can always go to the schools, and talk to the youth.
Okay.
The majority of the youth are in school. So that those who are not in school, then we can do like community engagement, focus group discussions with them, and then radio presentations to talk about some of these substances that we abuse and what constitute an abuse, and then what we can do when we are into this. So I think that was the whole idea.
Wow.
So by 2021, we had the organization registered with the Ghana Register Department, then we started. So I think that was the whole idea of the organization.
Wow.
Yes.
Wow.
Yeah.
Wow. So since 2021, right?
Yes.
So
officially 2021.
Oh,
okay. We were registered 2021.
Okay.
Yes.
With the help of that teacher, right?
Yes, please.
So for how many members?
So far, we have the directors are two. Myself, Alexander Kebe, and then a secretary, Felicia Tangomu, with an organizer.
Oh, okay.
Gabriel Mangwe, and then the other supporting staff.
Wow.
Yeah.
Do you base only in Navrongo here, or you extended your territories?
No, it's because I stay in Navrongo.
Okay.
But the NGO actually started in the China Power constituency, where it's China and Para. But because I stay in Navrongo, that's why. So we've now added this one. But we want to even do it in the whole of the Upper East Region of Ghana.
Very good.
So we are trying to expand, but this time around, funds and other things that we have, so challenges that we have. We are thinking if we even get to enroll it anywhere. Once we get the opportunity, we will do it. Just like you are giving us this opportunity, I think a lot more people will hear than what we were doing.
Exactly.
Yes,
right. So since you started, what are some of the substances that you've noticed these youth abusing?
In fact, a lot of substances. And what we realize is that if they get any substance, they will abuse. So now we get those they easily abuse because of the availability of those substances. So now we have seen that alcohol is largely abused.
Yes.
Now tramadol is coming inside.
Oh, yeah.
Women to abuse this family planning drug, postnatal and Lydia. Those drugs are emergency family planning drugs. We don't give them as regular family planning. But it's now allowing the young ladies, they take it after every sex, which has an effect when you really want to give birth. These are drugs that we give in emergency cases, like case of rape, case of other things that want to prevent pregnancy 72 hours after whatever incident. That is why we give those drugs. But now the ladies just take it after every sex, which can affect you when you really want to give birth. So then paracetamol too is one of the things that they easily abuse. Paracetamol really can affect your liver directly. So that's why we people have liver problems like hepatitis B, hepatitis C and what, we stop them from taking paracetamol because of the effect on the liver. But because it's available, any headache, any small pain, people take it. But it's not every condition you can take paracetamol. We have some conditions that once you have them, you can take paracetamol. So you see, we are not talking about the substance, but we're always talking about when you take it, why you take it, and the quantity that will constitute an abuse. It's a very useful substance Ghana Health Service is using. You see, so that is the problem. That's why we are out there to always give you education. When we enlighten you about what constitutes an abuse, I think we have a good way to stop most of these abuses.
So what do you think are some of the major causes of these things?
In fact, one major cause is peer influence. So in 2016, there was a survey where it came out that the peer said 90% of the peer said that it's not easy to say no to a colleague. So once I said, oh, I've taken this before, and I said, oh, it's good. Meanwhile, we are not the same. Even identical twins cannot be the same. But once I said it's good and I work with you, we are likely to try it. So we have a lot of causes, but peer influence is one of the major causes. We talk of family history. You wake up in a family that almost everybody abuses substances or takes substances. You are likely to try, oh, I don't know why this person is taking it, why is this? So you are also likely to take it. And as I said, the availability of it, and sometimes restrictions. There are no restrictions of like some of these substances that we abuse. You can just get up and find that anywhere and go and buy without any official way of like you acquiring that substance.
Okay.
So I think all these things constitute the abuse.
Wow. Wow.
Yeah.
All right. So since 2021, you've been actively working towards that. So far, what has been the impact on these youth that you're working on?
Yes, I think it's always very difficult to measure the real impact.
Okay.
But as we are here, most of them call.
Okay.
People will call and just tell you, oh, this thing that you came and said, I didn't know I was not supposed to do this.
Wow.
This thing you said, I didn't know we were not supposed to do it. So a lot of calls that come.
Okay.
In fact, we can't quantify the impact. But as we have reached out to over 5,000 youths,
wow,
or went to a lot of secondary schools, a lot of junior highs, and then radio stations. And now, you know, social media is everything nowadays. So we are using WhatsApp, Facebook, and what to reach out to almost all the youth. So we put our information out there, and people call. And as you see the content and what, I think the impact is really great, but to quantify it is very difficult. I think we one day try to see whether we quantify this, but we're actually touching up to people.
Oh, okay.
People are calling.
Okay.
Yes, please.
Wow, that is great. So, as young as he is, he's been able to collaborate with a colleague, teacher. He's a teacher, right? And they started this from scratch, and now they are impacting positively in the lives of these. This is what we all should be doing to help and to support. Okay, yes, he actually identified a problem, and he's done a massive thing to actually solve that problem. We must all be problem solvers. All right. So now, before we bring the conversation to an end, so far I think almost everything you involve yourself in, there are sort of challenges and all that. I'm sure definitely financial challenge will be the major one, because looking at your the work that you do, you need to be moving around from one campus to the other campus, getting to the radio station. I know most of the radio stations will charge you before they even get you the airtime to speak, right? So what are some of your challenges so far you've been facing?
To start with, just like you said, financial is one of our major challenges. As we go to the radio stations, we pay.
Oh, okay.
We pay for the airtime.
Wow.
In fact, our brothers and then other people are very supportive.
Oh, wow.
Some people give us, they will just pay for the airtime for us to go and talk.
Very
Some will give you the money. That is to collect and help the program. So we plead that if people can support us more, even if you won't give us the money, you can just go and pay for airtime for us. Or you have an organization that you are going to talk about something, you can just incorporate our topic into it, then we'll come and talk. I think that one we don't need to pay anything to do that organization. It should help us. So if people already have their organizations and they can invite us, I think they will have less expenses than like we ourselves going to organize people. So I think that's one of our major challenges. And now, as you know, we are in Ghana. Politics is one of our major challenges too. Sometimes, as you are interviewing me, I don't know your political stand. But if people get to know your political stand, they may think that, oh, you have captured the guy, that's why you have interviewed him.
Oh, yes.
So once people know you belong to this party, they may think because you belong to that party, now I also belong to that party. So other people from different parties will not like to support the idea, no matter how good the idea is. If you face instances like that,
that's when
people give us money. Once you go and mention the name that this person has given us money to do this, they say, oh, then you now
with these people.
Follow that person.
Wow.
So that is a major challenge to me as I'm sitting here. Whoever, even Satan come to give me money to go and do my program, I will go and do it. Because I don't think it's what I will do is the bad thing. The person may be bad, but when you give me to go and do good thing, I think it's an impact on my community, and not about the person's political stand.
That is it.
So that is one of the major challenges too.
Wow.
Yes, and work too. As I am here, seriously, I'm always overloaded with work. But because I have this passion, sometimes no matter how tired I am, and I have a program to go and talk about it, I will go.
Wow.
I will go and do it. So I think we have some challenges, but as we still persevere with this consistency and then the support from other people, we are going over them.
Wow.
That's what we are doing.
So we'll also, I'll personally encourage you to come into the aid of this young man. In fact, he's doing a lot for our youth. You know, the future of the country is the youth that we have today. And so if the youth keep on abusing these drugs at this age, you know, the country wouldn't be having any better future. And so let us all come together. We are doing our part now to let you actually know of him. And so wherever you're watching this particular video from, please, I will actually let him call his contact out there, so that if we want to get in touch with him personally, if also would want to support him in any way, you can also get in touch and support him, so that together we can also uproot the substance abuse and all that from the society. Now, my big brother Jesse, are you willing and ready to be moving around the country to be giving out such education?
In fact, anywhere I'll move to, I'm always ready at any time.
Wow.
So I think it's a passion.
Wow.
And let me just give you one small history of it. I was once somebody who abused substances.
Oh, okay.
I take a lot of alcohol. Like 8 years down the line, I have never tasted alcohol.
Wow.
And
that's
back
great.
down home, my father is one of them. So I think he motivates me a lot.
Yes.
Because if you know him, he's one of the intelligent ones.
Wow.
But that kind of respect and what he should have been having now is not because of just substance abuse. So I think once we see them like that, we shouldn't get there. So I would just like to plead to the youth that once you are a member, you can stop it. People say it's not easy, it's not what I was once. Somebody who takes alcohol. But I don't take alcohol for 8 years now.
Oh, wow.
I don't take, and I don't think I'll ever take alcohol again.
Wonderful.
But it wasn't good for me. And the work I do, if I was taking alcohol, I can't even do it.
Yes.
You understand? So when I look back home, my father, he motivates me a lot to even do more. You understand? Because I don't want somebody to get there.
Wow.
So I think if you are once a member, you can either stop.
Great. Let's tackle some of the effects.
Yeah.
I'm sure that one can also deter others from that.
Yeah.
Now, what are some of the effects of this substance abuse?
Just like I said, the work I do, if I was abusing substances, I won't be able to do it. Like your mental outcome, like you don't always have focused mind. Quite apart from the headache, the tiredness that we'll get. And some people are there, they will abuse the substance and reach on stage, they will know that this thing is an abuse. It's affecting me, but you can't stop.
Wow.
So, not able to cease using such drug is one of the effects. We even have some stages where people abuse substances to the extent that they don't know close relatives. Blackouts. Your own father will meet you and ask you, oh, where do you come from? The person doesn't even know you are the one. You understand?
Yeah.
So these are some of the effects. And ask,
do I know you?
Yeah, we met somewhere.
You are a relative.
Yes, please. So these blackouts, people get it. And as we target the youth, a lot of them are in school. I think the target of school is to go and pass and be successful.
Yes.
And when you start these things in the schools, I don't think you even get those grades to be able to move forward. Some they sack them, and I say, what even brought me to this is majority of them get these road accidents, and we lose a lot of the youth to accidents which are preventable. Wow. You understand? So these are some of the effects. Then we can have cancers. People smoke and get cancer of the brain. Some drink and get cancer of the liver, even the throat, and get cancers. And we have other diseases. You see that you can drink staple. You go and end up with a woman that maybe you are not able to protect yourself very well. Then you go and contract diseases. You understand? HIV, hepatitis B, and others. If there are those that we can treat in the hospital better, but these are those that we can manage. You see that it will not, your life will not be well as you are doing. We are impacting on youth. Sure. I don't think we are impacting on this sick youth. We want to impact on healthy youth.
That is it.
So that one alone, once you begin to take substances, you are already ill. What impact are we going to make again? There will even be a burden on themselves, society, and then the whole community or Ghana at large. So the small monies we get, we just concentrate on alcohol and the family. So you see that the impact in society will not be that much. And I think we all have to contribute small to make a healthy community of Ghana. Wow. So these are some of the effects. We have a lot. Yes. A lot of the effects.
Possibly. Right, let's see. Aside the education, I'm sure that's the usual one you normally give out. Aside the education, is there any other form of support that you give to them? These kind of affected people?
Yes, please.
Okay.
The NGO has not gotten to the extent of establishing their own rehabilitation centers. Okay. But what we do is that once I work in the health sector, I have some counselors where if some of the guys call, some they get me counseling. I link them up to a psychiatrist who counsel them. Okay. Some need medication. where they have gotten to, they need medication. For that one, we can do it in the hospital. I refer them to the hospital, we'll give them medication. Some need rehabilitation. That one comes with cost. So always talk to the families and then the client. When they accept and they have the funds, then we'll refer them for rehabilitation. So far, we have done that to one person.
Wow.
And the guy is successful. He's currently in teacher training college.
Oh, wow.
The guy who rehabilitated.
Oh, okay.
He's always happy anytime he meets me. He's very happy.
Wow.
We hope we'll get a lot more. We don't want people to reach that stage, but once you are in that stage, they will also help you. I think that's another help. We don't pray that people should even get there. But once you are there, these are some of the things that we can do for you.
Oh, okay.
The education, the drugs, counseling, and then rehabilitation. I think that is what we do.
Wow.
Yeah.
All right. So that is Mr. Jesse over here. And so if you're at school, if you are watching us now, if you're at school, an NGO organization, wherever, anywhere, for a church, whatever organization, we also want such form of education for your people. You can get in touch with him, and then possibly, as he said, he's readily available to be moving around the country to give out such education to the people out there. And then also, he doesn't only give the education, as you rightly heard. He also, goes a long way to organize a rehabilitation program for some of them, and all these involves money. Yes, it involves money. There are a lot of things that this young man will be in need of. I wouldn't want to speak for him. Now I'm giving him the chance, the time to speak directly with you, to tell you the kind of support that he needs, so that together we come into his head. My big brother,
yes, sir.
What are some of the support directly, personally, that you need for the organization? Okay.
I think there's what we need a lot. But just like you are doing, we need that hype. Great. A lot of people should hear of our information. I think when we spread it to everybody, that is one of the greatest that we can do. So as we are doing, that's the support we need. When we get more of your type, that will propagate the information that we have.
Great.
And that is one. Financially, we need them to help us to be able to move around. To even pay for some of the airtime, like transport to the place, to feed the people that will take there. And then I think financially, people can support me to do that. And equipment, a laptop, a phone that can always take a video or maybe a recorder. Sometimes we go to places. Sometimes we go to places that don't have light. So either go project. When we go to give the education, we project.
Oh, okay. Use the projector and stuff. Oh, okay.
We rent the projector every time we are going.
Wow.
Yes. So people can give us this equipment.
And these equipment are also not that expensive. I'm sure even one of my followers can get you one. So please, let us all come together and furnish them with this equipment. And I'm sure now that they're not having, now that they're even renting, just look at what they are doing, the positive impact that they are having on the people that we have over here. So please, let us try and do our possible best. Please continue from there.
Yes, a projector, a laptop. Sometimes when we get to places that have no light, we try to go and rent generator. Because when they see some of our slides, when they see some of the videos and audios of people abusing substances and the effects, when they see it, the impact is mild than when I'm talking.
Yes, exactly.
So sometimes when we go to where there's no light, we have to, and even where there's light, we need these projectors and other things to be able to work. And one thing is, I wanted to make a website for the organization. Once it's registered, once you make a website, people with the trust and other people, you can write proposals and what. I was charged 3,000 to do the website. You see. So as I'm talking to you, I don't still have a website. We just use this social media, WhatsApp, but if there was an official website for the program, you see that people will follow, and then others will actually see what you are doing. So if people can sponsor us, do these things. I know most people, they don't even need to sponsor us, but now somebody's listening who can develop a website. The person just give me your information, then I'll develop one for you.
Very good. Very good.
So I think these are things that if people help us, then will actually help the youth. So that's what we are doing in our small corner.
Very good.
The opportunity.
Yes.
We like to do it big.
Very good. And we're hoping and praying that it comes to pass. Yes. So that is Mr. Jesse over here in the Upper East region, Navrongo. Yes. We're still here at the region. The weather condition very nice. In fact, conducive environment. The environment is so serene, very cool, calm, no noise making and all that. In fact, I want to encourage you to also have a visit over here in the Upper East region. Whenever you find yourself in Ghana, if you're also in Ghana, you can actually come here and then have a visit into some of these things that we have over here. In fact, actually, there are a lot of tourist sites over here, and you can check and watch a lot of them on my channel right here, talking about the Paga Crocodiles Pond, talking about the slaves camp, and then the border. A lot of them, they all at my YouTube channel, where you can watch them, and then you also have a feel of the Upper East region. Right, so we're bringing the conversation to an end with our big brother Jesse, who is the director for Careline Health Solutions. Yes, and that is what I want you to please support him. He has said a lot, and I'm sure you are touched. In any way that you can support him, I would let him call out his contact. Please, what's your telephone number, your official number?
Yeah, 024
okay
58 70 900.
Again,
024 58 70 900.
Great. So your final words.
My final words to my dear youth.
Yes. So you can even look directly into the camera.
That's my target group. My dear youth, I would like you to please playing safe means let us do things that we are supposed to do, which can help us live healthy to achieve whatever plan we want to achieve in this world. When you are not healthy, all plans come to stay. They will never move on. So I think abusing substances and other things that we are not supposed to involve ourselves in, when we do that, it will never help us to reach where we are getting to. So I would say drug free, then a healthy youth, then we'll get healthy Ghana. So try to support this and be safe, my dear youth. Thanks very much for this opportunity. I think you are doing very great. A lot of people will hear me even more than what I was doing. So that's great. I'm very grateful.
Thank you too.
Okay, sir.
All right. Okay. God bless you too for your time. All right. So this is exactly where we bring the conversation to an end. And thank you so much for your time as well, for staying with us for this number of minutes watching this particular video. If you have been touched with this video, please take a few seconds and share this particular video for a lot of people to also have access to, because I'm sure this conversation will go a long way to, change a life of someone positively. And if it happens that way, then it means you was the agent. Okay, you were the agent of that. So we give glory to God, and also we thank you for your time and all that. Thank you so much, and don't forget to click on the subscribe button, and you follow as well. You like this video so that it can be shared to a lot of people out there. We're still in the region. Yes, we're still in the region. In fact, actually, we're still moving across the region to get you a lot of content, positive content, life-changing content like this one. Thank you so much, and do have a wonderful day.